Now, it is supposed to be summer, and even though there seems to be nothing but rain, it's still too humid and warm to want to be wearing stockings, which is tough if you suffer from varicose veins. So what are they, and how easy is it to get them treated? Naomi Timperley, who's in Manchester, has been treated twice. Ian Franklin is a consultant vascular surgeon at Imperial College NHS Trust in London and chairs the Circulation Foundation. Ian, what is a varicose vein?
Well, a varicose vein is the very bumpy, tortuous vein that we see running down people's legs, and that's what we see on the surface, but they're caused by faulty valves inside the leg. So the veins that you can see are the consequence of a problem inside the leg.
And they're different from the little fine veins that you might get on your thighs or indeed on your cheeks.
They are different, but they're related in that the fine spider veins or thread veins or broken veins or capillary veins are all exactly the same thing. But they're at one end of the spectrum. And the reason they're related is that if you seek to improve the cosmetic appearance of the spidery veins but don't treat the underlying varicose veins, it's a little bit like redecorating your house when the roof is still leaking. You don't get a durable result. So usually it's best to correct the varicose problem first before treating the spidery veins. And
what do we know about what causes them?
Well, that's a really interesting question, and we argue at vein conferences as to what the underlying problem is, but basically it's because the proteins in the blood vessel seem to relax and allow the vessel to dilate, and that makes the valves stop working. And once that starts to happen in the leg, high pressure blood starts to blow out from the deep veins into the superficial ones, and that's when you start to see the bumpy veins on the surface.
Naomi, if I can bring you in here, what do you reckon caused yours?
Well, I was first treated for mine when I was about 22. And quite frankly, I think, my mother had them, my father had them, my grandparents had them. I just think it runs in the family. I'm very fit and healthy. I always exercised. So I don't know. I personally think it runs in the family. I think if your parents have them and, both sets, I think you're destined to have them.
Ian, does it run in the family?
Yes, they do run in some families. And moreover, there isn't particularly a lifestyle measure that you can take to protect yourself against getting them. If you're destined to get them, you do tend to get them. There are some things which exacerbate it, but there's nothing that anyone can do to absolutely prevent that they won't form.
Naomi, why did you decide to get yours treated? Because some people don't, they just leave them.
Well, mine, I was actually having symptoms. It wasn't, for cosmetic reasons at all. My legs were aching, they used to get really itchy. So I initially had them injected. And then I had babies.
Injected with what?
Well, the doctor will probably tell you what it is, but it's basically this stuff that blocks them and then gets the blood to run through the healthy veins. But it doesn't last forever, unfortunately.
OK, Ian, what's the stuff?
But there's a number of different things you can inject into veins to stop them working. Just one comment that Naomi made, the itching in the legs. People often don't associate that with veins, but it's a very common symptom of veins. And more importantly, it's a sign that the skin is starting to be affected, because veins are not just a cosmetic issue. And if you have veins which are causing itching and irritation of the skin, that is a precursor to skin changes and pigmentation. And eventually, in some people, left untreated, you can get leg ulcers. So it isn't just a cosmetic issue.
So how common is it to do the injection that Naomi had?
Well, injection treatment is very, very flexible. The beauty of injection treatment is that you can treat almost any vein, or attempt to treat almost any vein with injections. And in the old days, basically, treatment was either stripping, which involved a general anaesthetic and going to the operating theatre, or injections, and that was pretty much it. And stripping was a big thing to have done, and injections worked for a while but weren't very durable. And the difference now is we've got a whole range of keyhole techniques for veins, so that it doesn't matter how bad the veins are or how unfit the patient. There's no patient who's too unfit, and there's no vein that's too complicated to treat with a keyhole local anaesthetic technique.
But Naomi, the second time you had yours done, when I think you were in your late 30s, after you'd had the children and all of that, you went for the stripping, the full Monty, didn't you?
That was all I was offered. I think at the time it was only 2 years ago, and I was actually lucky to get that, because I know there's usually a very big waiting list in some NHS services. I got a cancellation, and I had them done within 3 months, but I wasn't offered laser surgery. So yes, I had mine stripped at the junction at the back of my knee.
But you were doubtful about laser surgery anyway, weren't you?
Well, I had a friend, Emma, who had laser surgery, and obviously you had that under local anaesthetic, and I'm actually quite squeamish, and I think what put me off is when she said that she tasted burnt blood at the back of her throat while having it done.
Is that what you do to your patients?
That is a oft-reported story with laser treatment. Some of the lasers do that. There's other. I personally use other techniques, and every vein specialist has a particular range of favoured techniques, and you all end up with much the same result in the long term. In fact, there's lots of evidence to show that stripping, like Naomi had, works very well in the long term. The difference particularly is in the short to medium term, because after keyhole treatments, you really can go straight back to work. And we've got lots of examples. We treated one of our nurses the other day under local anaesthetic, who the same afternoon of her treatment went up and scrubbed up to take part in an operation. And we've got lots of other pictures of people who are, cycle off on their bicycles straight after having their veins treated. So the old stories of having to be off work for 2 weeks and wearing bandages, it's old-fashioned.
And
that was me.
How long does this kind of treatment last? I mean, would you have to have it done again?
Well, there's no treatment that you can do to someone's legs to guarantee that they'll never get another vein problem. It's a little bit like, if you go to the dentist, you don't expect that to be your last ever treatment. You expect one day to go back for a bit more treatment. Now, with veins, the recurrence rate is about 3 or 4% per year, so some people need treatment again quite soon and some don't need treatment for a decade or two. It's very variable.
But Naomi was saying that she found it difficult to get treated on the NHS. We've had a lot of listeners get in touch with us saying they have had problems getting it done on the NHS. Why? Why isn't it a priority?
Well, everybody appreciates that the NHS doesn't have infinite resources, and veins are a very variable thing, from a mild cosmetic thing to a very major thing. And the guidelines for treatment throughout the country are very variable. And in most places, if you've got really bad veins, you can get treatment. If you've got cosmetic veins, you can't. There's a bit of tension for those in the middle who have a painful, ugly vein, but the guidelines tend to be sourced locally, and they're not often very evidence-based. There's one particular PCT, as we used to call them, who required that a patient had to have bled enough from a varicose vein to require a blood transfusion to get their veins treated, which is a pretty extreme criterion. And most others are somewhere in between. Now, NICE are going to be updating their guidelines this year, which is going to be quite helpful for everyone. And the Venus Forum, which is based at the Royal Society of Medicine, have produced some very helpful guidelines this year, which can be accessed on the Royal Society of Medicine website, if that's helpful for anybody.
And Naomi, how are yours now?
They're fine. But I don't know if this has got anything to do with it, but I have legs that are like a road map of Britain anyway. I've got quite translucent skin, so I can see things that are probably going to pop up in the future. But the one that I had done, it's healed completely fine. You can't even see it. The vein's obviously gone, so it looks great. I'm very happy.
And Ian, I know you do private work as well as NHS work. If somebody were desperate to have it done and they couldn't get it done on the NHS, how much would it cost them to have it done privately?
Well, it depends what they have done. That's a bit like saying how much does it cost if you go into Tesco's. It depends what you put in the trolley. But if someone's got the simplest vein, then it'll be about £250 for an injection. If someone's got very complicated redo extensive veins on both legs and they choose a general anaesthetic, which is more expensive, it could be anything up to £5,000. So it depends entirely what the nature of the vein is.
Ian Franklin,